Hello everyone, my name is Titi Adevalinenggo from Yogyakarta, Indonesia. I'd like to present our research titled The Association of Pediatric Early Warning System Score Errors on Clinical Outcomes of Patients with Emergency PICU Admission, a prospective cohort study. Why we did the research? Patient management become more complex, and at any time, the patients may experience an unexpected worsening of the clinical condition. Previously inward pediatric patients who need unplanned PICU admission has a 13-fold increased risk of in-hospital mortality, increased morbidity, and longer PICU and overall hospital length of stay. PEWS was found to be a reliable and valid scoring system to identify children at risk for clinical deterioration. Agulnik et al. Found that there was a potential for PEWS error resulted in the PEWS scalar change of 8.8% patients who were admitted to the PICU. However, the relationship between PEWS errors and the clinical outcomes in the PICU hasn't been established. This study aimed to evaluate the association of PEWS errors on PICU length of stay, PICU mortality, need for mechanical ventilation support, and need for vasoactive drugs in patients who transferred emergently to PICU. This is a prospective observational study that was conducted in the Pediatric Intensive Care Unit in the Sarjito Hospital, Indonesia between January and December 2021. The subjects were the pediatric patients with emergency PICU admission. We collect the baseline characteristics, PEWS data, and the clinical outcomes of the patient in the PICU. We define the PEWS errors as a difference between documented and corrected PEWS resulting in the PEWS scalar change. A total of 623 patients met inclusion criteria. After excluding analysis, there were 70 patients who emergently admitted to PICU from the ward. 38 patients with PEWS error and the other 32 were non-PEWS error group. Hence, PEWS error was found in the 54% of all emergency PICU admission. That's a quite high number compared to other studies. This is the table of baseline characteristics. We found that the mean documented PEWS score at PICU admission was statistically lower in the PEWS error patients compared to non-PEWS error patients. It means the PEWS implementation in our settings should be evaluated. PEWS error patients had higher need for vasoactive drugs compared to those without error at first 72 hours and during PICU care. There were no significant differences in terms of length of stay, mortality, and need for mechanical ventilation support. Kaplan-Meier analysis revealed that PEWS error patients had earlier need for vasoactive drugs compared to those without error at 72 hours after PICU admission. PEWS had been implemented in our setting using paper sheets for 5 years. However, PEWS errors was quite high. The errors reduced the benefits of PEWS for patients at wards. The implementation of PEWS should be evaluated periodically to ensure consistency and minimize errors. The conclusion of this study is PEWS errors was associated with earlier and higher need for vasoactive drugs in patients with emergency PICU admission. Thank you very much for watching.